Governor Holcomb's press briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you must press the Raise Your Hand button. When called upon, we will unmute your microphone, and you must also unmute your own microphone. Thanks.
Good afternoon. Thank you again for joining us. We've got a full lineup for you today, a lot of information to cover. But first I wanted to start by, Dr. Box will go into this, she'll elaborate much more on this, but we've got a new color-coded map that works off of 3 key metrics and evaluates each county's status. This is going to be, I hope, a big help to citizens and schools and businesses, all that can kind of get a real-time snapshot look at how their community is registering in terms of positivity rates and others, and you'll go into all of that. We continue to work with schools, and we're trying to make this as easy to not just comprehend, but then to also use. And so Dr. Box will go into that new map that will be up. And then also we have, honor to have, Chief Justice Loretta Rush with us today as well. She's going to go through what I alluded to 10 days, 14 days ago, I guess by now, about, in layman's terms, courts, facilitation, options that folks may want to take part in, and helping landlords and helping tenants resolve any differences and avoid the actual courtroom. So we're looking forward to hearing from Chief Justice Loretta Rush. And also we have, as was mentioned last week, great to see you, Secretary Lawson. Connie Lawson is with us today, and she's going to update us all on how prepared we are for the election that is, I guess the end is November 3rd, Election Day, but we really start voting almost 28 days before that. So October 6th through November 3rd, so right around the corner, and she'll go over everything we are doing to make sure that your voice can be heard on or before Election Day. But first, I also wanted to address the actual day we find ourselves here today and the steps we'll be taking going forward. We're going to continue to remain in stage 4.5 on our Back on Track plan. We're going to continue with the mask mandate statewide for another 30 days. We're, on one hand, we're pleased that we've been holding steady, kind of steady Eddie, Indiana here in terms of our positivity rate. We don't want that to trend up. We'd like to see it start to trend down even more so. But again, Dr. Box will go into everything that is factored into how we arrived at this decision, all the different input that goes into it. So with that, Dr. Box, if you would, please.
Thanks, Governor Holcomb. Good afternoon, Hoosiers. Today, we reported 971 additional cases of COVID-19 in Indiana, which brings our total to 89,359 total Hoosiers known to have COVID. We also saw 18 additional confirmed deaths. To date, 3,041 Hoosiers have died of COVID-19, and another 218 are believed to have died from this disease based on their clinical diagnosis. Currently, nearly 37% of ICU beds and more than 83% of ventilators are still available. About 12% of occupied ICU beds are housing patients who either have been diagnosed with COVID or have symptoms of COVID. Less than 3% of ventilators are being used by someone who has COVID or is suspected of having it. We also have seen more than 1 million Hoosiers tested for COVID-19, up from more than 934,000 a week ago. We also continue to look at the data that provide the foundation for our decision-making as part of our 4 guiding principles. One is the hospitalization rate. As of August 24th, 987 Hoosiers were hospitalized for COVID or with COVID-like symptoms. That's still well above our 595 in late June. We saw 90 patients admitted on August 20th, which is slightly higher than what we saw in late July. Our 7-day positivity rate for unique individuals tested was 6.6 as of August the 18th. When you look at all tests administered, the rate drops to 5.4%. As I mentioned last week, we are now calculating both rates to better compare ourselves to other states that are using total number tested and not just unique individuals. In addition, we began including antigen tests in our daily dashboard on Monday because these tests are more widely used. We added these antigen tests because the method has become widely available and accepted by the CDC. Adding these antigen tests has not significantly increased our cumulative positivity rate throughout this pandemic. The cumulative rate stood at 8.8% on Sunday before we added in the antigen test and dropped to 8.7% with the addition of those antigen tests. We also continue to evaluate the data from our partners at Regenstrief. To date, they have looked at 85,462 cases. Of those, about 21% visited the emergency department, which is down slightly from last week. A total of 10,417 were hospitalized, which represents 12% of all positive cases. That is the same rate as the week before. Of those who were hospitalized, 20% were admitted to the ICU, which is down slightly from last week. That represents 2% of all positive patients, which is also a decrease. 75% of hospitalized patients have been discharged, which is a slight decrease. Of the remaining 25%, 7% are believed to still be hospitalized, 18% are known to have died while hospitalized. Regenstrief estimates that 79% of patients have recovered, which is an increase from last week. While we've been able to maintain stable ICU and ventilator capacity, our hospitalization numbers continue to fluctuate and run higher than what we saw in June, as I mentioned earlier. Another one of the principles to reopening our state is our ability to conduct contact tracing for individuals who are positive and their close contacts. We started with 500 contact tracers in May and currently have 680 employed at the centralized state contact tracing operation. When you add the nearly 300 local health department contact tracers currently in place and another 300 that Marion County plans to hire, that brings the statewide contact tracing workforce to more than 1,200 people. Since May, our state contact tracers have handled more than 352,000 calls and sent nearly 437,000 texts. More than 76% of these contacts have been successful, which means that we were able to connect and complete an interview. This rate is well above the 50% rate that we are seeing nationally, but it still indicates that about a fourth of the people who need contact tracing are not responding. We know that some people aren't willing to answer a call or reply to a text from an unfamiliar number and we are working to build awareness of the numbers that the texts and phone calls come from. So if you get a text or a phone call from the State Department of Health about an important public health matter, please answer the text, answer the call. All of these metrics are important as we look at where we are as a state and how to most safely bring people back to work and to school. Many school districts and local officials have asked for metrics to help them better understand what's happening in their communities so that they can make better operational decisions. We've developed a new color-coded map that evaluates each county's status based on 3 key metrics. Those are the number of new cases per 100,000 residents in the past week, the percent positivity as determined by the number of positive tests divided by the number of administered tests, and the change in the percent positivity from the previous week. The goal is to provide an easy-to-understand system that local and school officials can use to inform their decisions. I want to emphasize that this score does not trigger a requirement of action, but it provides information and recommendations. Each metric will be assigned a score of 0 to 3. The average of the 3 scores will be the county's total score for the week. Our first metric is our new cases per 100,000 residents. Less than 10 new cases will be assigned a score of 0. 10 to 99 new cases will receive a score of 1. 100 to 199 new cases will score a 2. 200 or more new cases will receive a score of 3. Our second metric is for percent positivity. If you have less than 5%, you will receive a 0. A rate of 5 to 9.9% will receive a score of 1. 10% to 14.9% will receive a 2, and greater than 15% or greater will receive a score of 3. Our third metric then will be looking at the change in percent positivity from the previous week to the current week. A decrease of 0.5% or greater will receive a score of 0. A decrease of less than 0.5% to 0 will equal 1. An increase of 0.1% to 0.4% will get a score of 2, and an increase of 0.5% or more will receive a 3. Once we have the average of those scores, we will place the county into one of 4 colors. Blue will be 0 to 0.9, yellow 1 to 1.9, orange 2 to 2.5, and red greater than 2.5. And you can see now how this looks on the map. Each color category comes with recommendations for school and school officials to consider based on what the metrics show regarding their community spread. Blue indicates minimal community spread. The recommendations would be that schools operate all grades in person, but limit activities where social distancing is not feasible. Extracurricular activities should follow state and local guidelines, including distancing and masks, and limit spectators. Outreach occurs to encourage, at this time, public to continue with their precautions. Yellow indicates there's a moderate community spread. The recommendations to consider here would be that schools continue all grades in person, but have increased vigilance with the social distancing, hand hygiene, and use of masks. There should be no assemblies or activities that occur if social distancing is not feasible. Schools should postpone or consider canceling extracurricular activities as warranted, and consider allowing parents or close family to be the only attendees at athletic events. And we should consider that it's important to work with the local health departments to determine if increased precautions and public outreach should begin to halt further spread. A county in orange would be experiencing moderate to high community spread. In this case, the recommendations include grade schools continue in person and that a hybrid learning approach be considered for middle and high school students. Consider having no assemblies or large group activities. Consider extracurricular activities are limited and have maybe just the competitors and the participants only with no in-person attendees. We would also recommend that schools have discussions with their parents about limiting social events outside of school. We continue to see many of our cases associated with sleepovers and parties outside of school, but with school friends. We also recommend that county education leaders work with their local health department to consider implementing aggressive prevention efforts in schools and communities. Red counties are experiencing high community spread. For these counties, the recommendations to consider are that grade schools could remain in person, or you could consider hybrid if you can't social distance without that, and middle schools and high schools should consider virtual learning. No assemblies or large group activities should be considered or held. You should consider canceling extracurricular activities, and we would discourage social events. We would also again encourage county education leaders to work with their local health departments to consider implementing aggressive prevention efforts in schools and communities. All school systems are asked to make every effort to keep one school building open, even during high community spread, so that we can assist those students who need remote learning, who need to be ensured of a safe environment, and to provide food security. To better understand how this all comes together, let me show you a couple of counties. First, let's look at Daviess County, which is in the red and has an average score of 3. This score is based off of 243 new cases per 100,000 individuals in this past week. Also, their current positivity rate was 18.4%, and that was, again, total test over total test administered. They had an increase in their percent positivity of 9.3%. All three of these metrics earned a score of 3. So if you add those together and divide them by 3, that's how you come up with 3, which places them in red. Now, our State Department of Health has been working with our local health officers and local health departments in both Daviess and Martin County because both of them appear in red. We know that in Daviess County that there was a large outbreak in a church there that had to be closed, and that there are several businesses that have many cases that they are also working with. We know that these individuals have asked for more testing, and so the State Department of Health will actually be there on Thursday or Friday and Friday this week from 8 a.m. until 6 p.m., and we'll be running a drive-through testing there for all individuals. The site chosen is in Daviess County, but it's very close to the Martin County line. I also want to talk about Adams County, which has been very successful. They had been in orange and red due to an outbreak there associated with an establishment that had to be closed and the need to reaffirm the wearing of masks in their county. But now their situation is improving, and they are in blue with a score of 0.7. That score reflects 53 new positive cases, which earned a score of 1, a current positivity rate of 8.1%, which also scored a 1, and a significant decline in their positivity rate, which received a score of 0. What I want to emphasize is that these metrics change. A county that's in red today won't necessarily stay there if people take the right steps and contact tracing is successful. And a county that is in blue today can easily change colors if people ignore social distancing, refuse to wear their masks, and continue to go to work or school if they're symptomatic or close contacts. The best way to get counties into blue and to keep them there is for every Hoosier to make the choice to protect others. Thank you.
Thank you, Dr. Box. Very thorough. And I am very pleased that it's online so folks can look at it. We were, as you were building this, going over a couple versions, and it just, what you said, 4 days later, a lot can change. I mean, this can spread fast, and you can bend it up or down according to our actions. So having that information at your fingertips literally could make a big difference in where your county ends up on any particular day. And just to go over, I mean, you went in depth, but thinking about where we were, that statewide positivity rate, back in June, mid-June, we were at 4.4%. In July, we were at 7.6%. And then August, 7.3%. So it's fluctuating. 6.6% August 19th. So we'd like to get this down under
Definitely
under
working
5.
the trend down, and we want to get down to 5 or below for sure.
And again, I mean, when you look at the map that was just the slide that was just put up, I mean, you want the whole state to be blue. So we've made a lot of progress in 4 days, but clearly our work is yet to be done.
I think the interesting thing about the map, sir, is that as we work with the local health officers and health departments in the counties that are orange or red, many of them say to us that individuals in their community just don't believe in the mask mandate.
Right.
So they don't wear their masks.
But this works. I mean, this is
Hopefully.
proof positive that we need to be doing. There's certain things that we just need to be doing, and that's what you just are ticked off. And that's, the masks are key, physical distancing, managing our way through this, good hygiene, all those things add up to put you in a very strong position. And then we can continue to see more people go back to work and go back to school. And when you go from a 15 or 17.5 unemployment rate just a couple months ago to a 7.3 8% unemployment rate. We're clearly trending the right way in terms of our livelihoods, and we're finding the safe ways to go back online or back to work or back to school, proving it can be done. The key is going to be to do it safely.
And consistently.
And consistently. And when we see other states around the country who have clamped down even more so, shut down even more so, and driven that positivity rate down, we don't want to return to those hunker down, shelter in place, stay at home, 100%. We want to continue to drive that unemployment number down. Obviously, it's not just good for our private sector, but what our private sector can then do for our social services as well. So thank you.
We're going live. We'll see the map live on next Wednesday.
Okay.
So what's going to happen, sir, is that every week, as of Sunday night, we will have the data. We'll do all the calculations and the colors on Monday. That'll give us time on Tuesday to reach out to local health departments and officers and counties and work with them as to where their colors are, and we'll post that on Wednesday. So next Wednesday.
Well, I'm going to keep both of these.
I can get you copies, sir.
I'm going to compare costs, so to speak. With that, again, as I said, it's an honor to have Chief Justice Rush with us today, and she's going to go over some of the progress that the court has made. We talked about a few weeks ago, and the facilitation program that you have between landlords and tenants, if you would.
Great. Thank you, Governor Holcomb. Appreciate you having me here. I'm going to start off with a little bit about courts in Indiana and what's happened during the pandemic. Judicial branch has been open. We have followed the guidance of the CDC and the Indiana State Department of Health, and thank you, Dr. Box. You've been very helpful in reviewing a lot of court plans and appropriate protocols and precautions. We've had an expanded use of technology and adoption of new practices by lawyers, judges, and court staff to keep proceedings going. Courts around the state now are further expanding their operations, and we are safely accommodating jury trials. So jury trials are happening around the state. And I just talked to Dr. Sullivan. She said she got a jury request. So to allow, our Constitution says courts shall be open. So to allow public access to the court safely, we are live streaming. Many counties are live streaming their proceedings on a platform that are on the Indiana Supreme Court website. And you know what? Viewership is up right now. People are watching their court hearings, so you can go on the website and see court hearings around the state. So court emergency plans, pandemic resources for judges, lawyers, and court customers are all available online at courts.in.gov/COVID. But the main reason I'm here to talk to you today is about an opportunity. There's one area where we see a high number of cases that need to be addressed both safely and effectively, in a manner that is fair to both landlords and tenants, and that's evictions. These disputes carry high stakes for both parties. Until now, the only way to resolve them was to go to court, pay a filing fee, maybe hire a lawyer, take time off work. But today, I'm announcing the Indiana Supreme Court launched a program to afford landlords and tenants the opportunity to work out a potential dispute with a neutral facilitator. This program is available at no cost to either party to initiate before a case is filed, or if the case has already been filed once the moratorium ended, it can be during the case. The landlord and tenant, and you'll see the website up on the slide, the landlord tenant simply goes to the Indiana Supreme Court Fast Track Facilitation portal and completes a form. Our staff will ensure both parties consent. Both parties have to agree to the facilitation and refer the matter to a trained facilitator who will schedule a remote settlement conference. So we're providing licenses to the facilitators. It can either be done by phone or it can be done by Zoom. If the courts reach an agreement, the facilitator will put it in writing and provide copies to each, and if necessary, to the court if there's a court proceeding pending. Again, there's no cost to either party. Possibilities include negotiated payment plans, back payments, could be move-out dates, again, without legal costs and also the stigma that comes along with having an eviction. I'd remind everyone that in 2009, we started a mortgage foreclosure trial court assistance program. That facilitation is in place, so there's facilitation for not only evictions, but also for foreclosures. I want to thank the Indiana Bar Foundation, the governor, many of the bar associations around the state. Our law schools have pitched in on this to promote and endorse this endeavor. We had a very hard-working task force, which included representatives from tenants, representing tenants and landlords and law schools that helped put this together in this short period of time. and finding that this program would not be available unless we had registered mediators. So we've only had it up and running for a couple days, and we already have over 130 facilitators. These are senior judges, registered mediators, and great lawyers from all over the state. So we really thank them for their civic spirit, their willingness to help. This program is ready to go. They're actually facilitators, not mediators. The facilitators will all have training. They will be paid we're using some CARES money that we graciously got from the governor's office, the Indiana Bar Foundation, and some other resources to pay for the facilitators. So thank you for letting me describe this program. We are very enthused about it. And again, Dr. Sullivan said the number one call, she's getting a 211 right now, are people concerned about evictions, and we want to be part of the solution. Thank you very much.
Thank you, as always. And you're able to stay with us, right, if we have any follow-up questions? For a while, yeah. We'll stay on schedule. Also, we have someone else who's been very, very busy. You've got a lot on your plate with PPE and mail-in ballots and different ways to vote early. It's cyber threats and security, poll workers, et cetera, et cetera, et cetera. Do you want to just take a deep dive into all that's going on in your world?
I would love to.
Thank you.
Thank you, Governor. Today, I wanted to give an update on preparations for the upcoming elections. First, I want to make it clear that we are going forward with a normal election process here in Indiana. We will not be making changes like we did in the primary since the stay-at-home order has been lifted. We've been working feverishly behind the scenes to ensure that we can protect poll workers and voters. We are going to supply personal protective equipment. In fact, we have procured this equipment already to counties. Poll workers will be provided with masks, gloves, hand sanitizer, and sneeze guards. We also will have masks, gloves, and hand sanitizer for voters. In addition, we are providing disinfectant for voting equipment, including voting machines and electronic poll books. The Indiana National Guard is helping us sort and ship this equipment to the counties. And as they were in the primary, they have been a tremendous help to us. So I just want to thank all of the men and women involved in this sorting and delivering, as well as the governor and General Lyles. Thank you so much for your assistance. And even though we're not making changes for the general elections, we still expect an influx of absentee by mail ballots. We have a forecast that predicts that between 1.3 million and 1.8 million Hoosiers will vote absentee by mail this general election. As of this morning, we have 99,146 requests to vote absentee by mail, compared to 53,818 that were requested for the entire election period in 2016. We are working with the post office to ensure that ballots are prioritized by the Postal Service and are received in a timely manner. The post office is helping counties design envelopes so mail sorters and carriers can easily identify election mail and prioritize its delivery to voters and to the counties when a voter returns a ballot. You know, I heard the postmaster say when testifying before Congress that in order for the post office to timely deliver and process ballots, they need them to be requested at least 15 days in advance of the election. And if a voter returns them by mail, they need that ballot to be in the mail at least 7 days in advance of the election. That means, and I agree this is not Indiana law, but this is what you can do to help the post office deliver ballots in a timely manner. That means if you want to vote by mail, you need to mail your application no later than October the 19th and return it by mail to the county no later than October 27th. However, in my sage advice would be, don't wait. If you know you're going to vote by mail, apply today. Go to indianavoters.com to request your ballot. We have been asked, some of you have noticed that counties have not started sending ballots. That's correct. And that's because we have to wait until the candidates for president are certified. As you know, Democrat National Committee had their convention last week, and the Republican National Committee is having their convention this week. So once that is complete, counties will finalize their ballots, print them, and begin mailing. Likely you might receive, if you request your ballot today, you could look for your ballot or your application to come by mid-September. I'm sorry, your ballot to come by mid-September. I've been getting several questions as well in regards to who can vote by mail in Indiana. In Indiana, you can vote absentee by mail if you meet one of the listed 11 reasons, and these reasons include, but are not limited to, you might be working all day on election day, or you might be out of town all day on election day, or you might be at least 65 years of age or older. However, these reasons do not specifically specify COVID-19. There is an exception for those who will be confined due to illness or injury. I've had a lot of questions on whether this qualifies someone who is afraid of getting COVID-19 at the polls. If you're confined to your home because you have a condition that puts you at high risk and you are self-isolating, you may qualify to vote absentee by mail. But if you're still going to the grocery store and running other errands, you're not confined to your home. I want to take this moment to point out that recent traffic patterns show a return to near normal for Hoosiers. We know that Hoosiers are returning to their normal activities. And also, if you don't qualify to vote absentee by mail and you don't want to go to the polls on election day, you still have options. Indiana has one of the longest early voting periods in the country. We allow anyone to vote early in person beginning 28 days prior to the election. This year, early voting starts October the 6th. You don't need an excuse. Simply go to an early voting location in your county and cast your ballot. And my advice again would be, if you're worried about getting caught in a long line on election day, vote closer to that October the 6th opening of early voting rather than waiting till the close of early voting, which is on noon, November the 2nd. All counties are required to provide early voting options for 28 days prior to the election. And in almost every county, you may vote at your county clerk's office. Many counties have additional locations. Counties are required to be open the 2 Saturdays prior to Election Day for early voting as well. This is 4 weeks of voting opportunities. Take advantage of it, and if you aren't sure where you can go vote, go to indianavoters.com to find voting locations and hours in your county. And while you are there, make sure you're registered to vote. The deadline to register is October the 5th. My team and I, along with county election officials across the state, have been preparing for Election Day for months, but we need your help. It takes an army of volunteers to run elections, and we need you to sign up to be a poll worker or to count absentee ballots. Our democracy depends on Hoosiers like you taking the initiative to play an active role. Plus, it could be a paid position. You can earn up to $200 for your service, depending on your county. The qualifications to be a poll worker are simple. You need to be a registered voter in the county where you wish to volunteer, and you have to be at least 18 years of age. However, there is one exception. 16 and 17-year-olds are allowed to work the polls with permission. And in Marion County, where we have the greatest need for additional poll workers and absentee ballot counters, you are not required to live in the county to be an absentee ballot counter. So for an example, if you live in my county, Hendricks, and you could be an absentee ballot counter in Marion County. And if you can work the polls, please reach out to your county election administrator or local Democrat or Republican Party today. You don't need to be an election expert. Counties provide training to poll workers prior to each election, so there's still plenty of time to learn the process and become a vital part of our democracy. We are also reaching out to organizations like the Bar Association, the CPA Society, and the Realtors to ask their members to work the polls. If you have an organization that would like to work with us to recruit poll workers, please reach out to my office and let us know. The need for poll workers is critical, so we will begin airing ads also for poll workers, asking them to volunteer. I also want to take this opportunity to give voters an update on how we are securing elections from cyber threats. First, let me say, voting machines are not connected to the internet. However, in 2016, the Arizona and Illinois statewide voter registration systems were compromised. The hackers got into these systems through phishing emails, which are emails that get people to click on links or attachments. And if someone clicks on the wrong link or attachment, it enables the hacker to access their computer. There's no evidence that any data was manipulated in 2016, but we cannot allow unauthorized access to these systems. To ensure the safety and security of Indiana's system, we have contracted with a world-renowned company. They are providing an intrusion detection system that prevents hackers from gaining access to our systems. We have used federal funding to put these detection systems on not only state computers that access the statewide voter registration system, but on all county computers throughout the state. We know this is critical because it was county users that unfortunately clicked on the wrong link and allowed hackers to access the Illinois and Arizona databases. Our intrusion detection system not only protects the voter registration database, it also protects all county computers, saving counties thousands of dollars in cybersecurity fees to protect all county data. It's a huge victory for Indiana. Several other states are looking at our program as a model as to how they can protect their states like we're doing here. I'm proud of this effort. It makes Indiana one of the most secure states in the nation, if not the most secure. Governor, I appreciate you giving me the time to update voters. I turn it back over to you.
Well, we really appreciate all the hard work, much of it obviously behind the scenes, but gives us a high level of confidence going forward. And just to reinforce, you said this, but everything that all the poll sites had, all the PPE that they had on primary election day and going into the primary, they will have that again.
They will have that, and the poll workers will have N95 masks. We were able to procure those for poll workers, and we were able to procure enough masks for voters and gloves and hand sanitizers for voters as well. Our focus in the primary was to protect the poll workers. We have enough now to protect voters as well.
That's awesome. Thank you. So obviously, it's been somewhat of an unprecedented historic year, and no better year than to volunteer and to do your civic duty, whether it's as a mediation facilitator or as a poll worker. This is, as you both said, civic duty. And we're all in this together. So we'll get through it safely together too. We have the resources and the means to do so. But if you have an interest in volunteering, we want to get you plugged in. And with that, Shelby, we'll go right to the Q&A.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. I have a question for you and a question for Dr. Bucks, both on the subject of the thresholds that we're looking at as we go through the stages. First, my question for you is there a specific threshold that you want to reach on our various metrics before loosening either the mask mandate or stage 4.5, or failing that, is there an amount of time where you need to see just the general downward trend?
Yeah, and that probably will run right into your answer as well. But there's not, Eric, but that is the million-dollar question, and that would certainly make it easier on everyone if there was one single source of input or data or information where you could say, if below 5%. I mean, I honed in on that in my remarks, informal as they were, as one of the thresholds, but you can't just pull out one piece of the information without understanding how everything else is affected or affecting that rate. You want to, before he gets to his second, you want to just...
So I think it's really important to remember that even if we are able to get, for instance, our percent positivity down below 5%, where we consider that to be minimal community spread, the way to keep that there, the way that we have right now to affect that are the same things that we've had from the very first day this pandemic started, and that's careful hand hygiene, social distancing, staying home when you're sick, staying home if you're a close contact, and wearing your mask, because that decreases the spread of the virus. So That's my answer.
Yeah, and Eric, maybe even more important that, when we stayed home, we started to drive the number down. Now, we don't want to stay home, so that means you have to do other things as well. And when we had the mask mandate, I don't even want to think about had we not done that and some other measures all over the state of Indiana, and had Hoosiers kind of buy into it business by business, and a lot more signage is up. And when you start to see folks being proactive and not reactive to a negative situation, that's where we're keeping this at bay. And so that's why we don't want to be tethered to any one indicator, because we also have to assume what's happening one county over. You mentioned Martin and Davies, or it could be the donut counties here in central Indiana or the region. How is it bleeding over county lines and with that traffic? And so, no, it's not one thing. It's got to do with resources on hand to be able to care for those who need it, where they need it, when they need it, how quickly we can get it there, and bring more resources online. Your second question?
Yeah, second question, and related to that, probably more for Dr. Box. That's been what both of you have said for quite some time, that there's not a single threshold, and yet we're unveiling this new scoring system, which, while it's a recommendation, is definitely setting thresholds. What prompts that change in the approach?
The multitude of individuals that have asked for guidance and recommendations. I would say also that these specific metrics are part of metrics from the CDC and HHS, and that's why we've chosen these. And this is a way for counties to start to see where they are in comparison to other counties, to see why they may be having the number of cases that they're having, and to have a concept or an idea of what they might be able to do to affect change there. It also is a good way to say, hey, we're kind of creeping up from, the higher number in the blue to now we're in the yellow, and maybe we're in the higher number of yellow and we don't want to get into the orange and the red. So what can we do to make a change, affect a change? So it is a week-by-week look for counties and elected officials, public health, and really Hoosiers all over the state to keep track of.
Yeah, and Eric, I would just say we'll continue to not only react to, but solicit local input. We want this to be the easiest, in its easiest format to digest and then use as a tool in your local toolbox. And so as we continue to hear and work with, this is just another step in trying to present information in a format that can be easily referenced and then hopefully used and followed.
Sarah Cooper, WNIN.
Sarah, good afternoon.
Hi, thanks for taking my question. This is kind of a throwback question. Back in April, the governors of 7 Midwestern states, including Indiana, announced a coalition to coordinate reopening the economy. But then we didn't really hear much more about it. Can you tell me what that coalition looked like, and is it still active? Could you just kind of expand on that?
Sure. Yes, we still, it's not just the governors from Minnesota to Ohio, obviously everything runs through Indiana, we like to believe, it's crossroads of America, but this coalition especially, still keep in touch, still swap best practices, still commiserate, still share what we're all dealing with on this front, as well as the economic front, as well as civil unrest that is kind of related to this in some forms and fashions. And in addition to that, our staffs are connected as well, whether it be at the Department of Health or here in the governor's office, and making sure we're all up to date. And then in addition to that coalition that you just, specific one that you referenced, we're also on a very regular basis, weekly, talking with our federal partners and every governor across the country who chooses to participate. We do on a weekly basis. And then also in addition to that, I am on a phone call at least weekly with my counterparts, gubernatorial cohorts in Kentucky and Ohio. So Mike DeWine and Andy Bashir and I are on the phone at least once a week. So a lot of communication back and forth, but it's not just me, it's not just this office, it's also our agencies and staff members that are connected on a very regular basis.
Nikki Kelly, Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Hi, this is for the governor and also Secretary Lawson. You mentioned that if you were confined at home, maybe with an underlying condition and fear of illness, you might be eligible to vote absentee. Isn't there a way to clear this up through the Election Commission by just saying that fear of illness counts as voting by mail? And do you support that?
Shall I go ahead?
Sure.
Okay. So, Nikki, a confined voter is considered someone who is at home due to an illness or an injury, and then they can request an absentee ballot be sent to them. And as I mentioned, if you're still running to the grocery store and running other errands, you're not considered confined. And to my knowledge, there is no scheduled Indiana Election Commission. That would be at the call of the chair. And I don't know if that would be something they would consider or not, but it is not on the plate right now. I would say that it's if you get a application to vote absentee, it's really up to the voter to decide which one of those reasons applies to you, the voter. And so it's up to the voter to decide.
Sherry, Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Box. Dr. Box, we've sort of been hanging out at the 75 to 76% effective or success with contact tracing number. Can you discuss how many people then are likely to be in, quote, quarantine who've been contacted by a contact tracer, and also whether 76% is effective at stopping the spread of disease, whether tests are still being delayed. In other words, testing and contact tracing are sort of the two means of stopping disease spread. Are they currently working at the numbers and timeframes we're seeing now?
So I think the turnaround on test times is very much improved in the state of Indiana, not only with our own local labs that are part of our lab testing network, but also even those labs that are send out with LabCorp testing here locally and nationally and Quest. They were a little slowed down with the South, but those have again improved. So I think that the testing turnaround time is much improved and not a barrier at this moment. I would say that not answering a text or a phone call when you have a positive case, you are positive yourself, and we're trying to trace contacts, that's definitely a barrier to us decreasing or stopping the spread of this virus. And so it is critical, and we are in the process of working on a campaign basically to get out in front of this, to try to help people, encourage them, like we had with the Mask Up Hoosiers campaign. Please answer the call, Hoosiers, when you get it, or answer the text. That's so important. We are in Indiana, and the federal individuals, Dr. Birx and her team, think that the text has really made a difference. So we're about 25% or more higher than the rest of the nation with getting individuals to respond and actually taking that initial interview and getting the contact. So we're very pleased about that, but still very concerned about the remaining 25% or so.
Rob Burgess, Wabash Plain Dealer.
Good afternoon, Rob. Thanks for joining us.
Thank you, Governor. Appreciate it. I had two questions, one for Dr. Box and one for Secretary Lawson. Dr. Box, what do you make of the CDC's latest announcement that asymptomatic people do not need to be tested? And Secretary Lawson, there are no unmanned ballot drop boxes in the state. Would you consider changing this and distributing these starting with this election or any time in the future? And why or why not?
So I'll start first. The CDC's recommendation to not test asymptomatic individuals, from the very beginning, we have been very clear about our priorities of who needs to be tested here in the state of Indiana. Obviously, the symptomatic individual needs to be tested. When we say not testing asymptomatic people, it's important that Hoosiers understand that if you're asymptomatic but a close contact of someone, or you're a close contact and you work in a long-term care facility or in a hospital system, and we're very concerned about you being an asymptomatic positive and taking that into your workplace, please still get tested. To date, you can still go to all of our sites that we do for drive-through and our Optum sites, and whether you're symptomatic or not, get tested. Of course, as time goes on, if it becomes more of an issue for us to be able to test the number of positive individuals or the individuals that are symptomatic, if we have more issues with being able to get the supplies that we need or the reagents that we need to run the tests, we may have to become more strict on that. But for right now, this seems to be working well for the state of Indiana.
And then
Yes.
Connie.
Yes, Rob, thank you for the question. Indiana law does not allow for drop boxes. So if that were to change, it would have to be up to the General Assembly to change that. I would say that if you vote absentee by mail and you're very concerned that your ballot might not reach there in time, you personally can drop your ballot off and take it to the county, or at the county clerk's office. It has to be at the county clerk's office, but also a member of your immediate household could do the same for you. And I would say we would have to definitely look at how those drop boxes would be manned because there is limitations on who can drop off ballots by Indiana law.
Tom Davies, The Associated Press.
Good afternoon, Tom.
Hello, Governor. Thank you. What more will the state be doing to get people to follow the mask mandate since those major metrics that you've talked about on deaths and hospitalizations haven't really gone down in the past month, and there's still many instances we see of risky behavior?
Yeah, I mean, this will be a work in progress. Our work will never be done until we're on the other side of COVID-19 or any, as long as it's as as infectious as it is. We're going to continue to have to educate and work with locals and encourage more signage and lead by example, and the list just goes on and on and on. But I mean, there are some folks who don't believe it helps. I would disagree and offer science as the counter argument to that. But then we've just got to encourage one another. And what sets us back is when we're constantly reacting. I like to play offense. I mean, maybe it's just the basketballer in me, but we have to play offense and defense in this scenario. And we see it does work. I mean, you talk about, overall, but again, I shudder to think about where we'd be had we just said, come what may. We're just going to continue to act like this isn't an infectious virus that's spreading through airborne droplets. So what are we going to do to slow the spread? Sherry mentioned stopping the spread. I'm interested in, yes, stopping the spread, but I'm also interested in slowing the spread so we can manage our way through it. And that's what we're doing right now, keeping it below 9%, 10%, 8%, depending on the week. You want to add anything else that we could?
Well, I would just say that, we are more open than a lot of states. And when you look around, we've got kids back in school now for several weeks. We've got businesses back functioning. We've got universities that are back. And it's not that we haven't had more cases, but we certainly, when you look at our percent positivity, have continued to tick down rather than up. So, and if you look at specific counties that are having issues, many of them are the first to admit that the mask mandate is just not being used there. So I think that other things that we can do as Hoosiers is if we go into an establishment or a retail place where they're not wearing masks or they don't ask their individuals that are there shopping or eating or doing whatever to wear masks, they're not social distancing, maybe choose to take your business elsewhere, not only to protect yourself, but others that are there.
Brock Turner, WFIU.
Hello, Brock.
Hello, Governor. Just a couple questions here, one for Dr. Box and then one for Secretary Lawson. We'll start with Dr. Box. I know you mentioned sort of how the state has ratcheted up hiring for contact tracers. Do you still feel like there's a need for more of them? Or do you think the numbers are sufficient? Because I know it does get harder to contact trace and maybe it takes longer as people are going out and traveling more and maybe being in schools.
We are very data-driven at the state level to determine how many we need for the centralized contact tracing based on, whether there's any wait for calls to be answered or text to be sent out. So we are really driving the numbers based on the data that we get back. Many of our local health departments, as you know, are working overtime to try to assist with contact tracing and to really be the boots on the ground to not only help schools, which is a daily process for them, but to also help institutes of higher education if they're in their communities, to work with us and our strike teams when we go out to different industries and long-term care facilities. So certainly they may be increasing their workforce at the same time.
Okay, thank you. And then for Secretary Lawson, I know that your office has insisted really throughout this pandemic that the elections will continue on as normal, with as close to normal as possible with PPE and whatnot. But do you think that's sort of contributed to the shortage of poll workers at all? And then is the poll worker shortage greater this year than it has been in years past?
Well, counties have always had issues recruiting poll workers, and I think the issue has been over time that our poll workers are aging. And so, of course, this year has been a little more difficult because if you're an aging poll worker, you're over 65, even if you don't have an underlying condition, you're at high risk. And so, I think it's, in a way, it's a blessing. Maybe we can recruit some other folks who are interested in, who are younger and are interested in helping us out and learning how to be a poll worker and then continuing to be that poll worker, because our poll workers have traditionally been over 65 and certainly very close to 70, some of them even 80. So we need to recruit a younger group of people. But I would say, from what we're hearing from the clerks, it's better. They're recruiting more people and getting more confirmations for this general election than they were in the primary.
Kayla Sullivan, Fox 59.
Afternoon, Kayla.
Good afternoon, Governor. I have two questions. One, what's your message to Hoosiers who are frustrated by the mask mandate and don't believe the plateau we are seeing is enough to justify another 30 days of masking up?
Well, I mean, I can understand their frustration. I'd like it to go away as well. They share a frustration that I think folks are feeling in 49 other states and territories and nations all over the world. And what we have to deal with reality, and that is, what is our, for example, our positivity rate? How fast is it spreading? Is it spreading in fraternity houses? Is it spreading in church services? Is it spreading at work? Is it spreading at home? Is it spreading when we let our guard down? We just have to deal with reality. And the sooner we deal with reality, all of us, all 92 counties, every citizen, as soon as you look at this through the eyes of not just protecting yourself, but who you're around, unknowingly spreading it. That's why playing defense is so important in this. Then the sooner the state of Indiana will bend that positivity rate down. I mentioned, as you said, plateauing. We want it bent down. We want to drive it down under 5. So we can get more people even back to work, or those capacity levels. But we can't do that while it's still roaming around, in the hills and hollers of the state of Indiana, in rural counties, in suburban areas, and in urban areas. So it's not just a densely, what this map shows you and changes is it moves around, and it adjusts according to how we adjust. You want to add, pile on?
I think you gave an excellent, description of it. I know it's frustrating, but reality is reality, and we have to do what we can do as Hoosiers to decrease the spread of this virus until we have a vaccine that's highly effective and people are vaccinated, or medications that we could potentially treat this virus with. And we don't have either right now, so for right now, we have to deal with where we are.
Yeah, and I would say, look, we've had a number of encouraging signs, and I've mentioned positivity rate a couple times, but when you look at the number of jobs that are private sector jobs that are going back online, folks going back to work, we're proving, because of the ingenuity of folks in the private sector, they're proving that they're nimble and they can adapt and they can increase worker safety and security in this new normal that we find ourselves in. And that increases consumer confidence, and it's a positive cycle. And so when you go in somewhere and you recognize, that's the Hoosier hospitality pledge and promise. That's what that's all about, is sharing what we're all doing to get through this together. And that's going to increase confidence. That'll increase us all getting back to work while we're managing that number or driving that positivity rate down.
Excellent. And my second question is, how close are we to technology allowing voters to see how long lines are at each polling location? Is it possible to have this ready for the general election?
Well, Kayla, that's an interesting concept. I will tell you, actually, there was an IT person in Vanderburgh County that developed a system where a voter in Vanderburgh County could get on the app and determine where the longest lines were so that they could avoid those long lines. I will say it takes some cooperation from the poll workers, so they had to count like every hour on the hour, or maybe even every half hour, how many people were there and how long was it taking them to get through the polls so that they could vote. So I think it's possible. I would call on, entrepreneurial IT people to help us develop that app.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.